I'm Courtney Skierczynski, and I'm a graduate nurse practitioner student with Auburn University. And this evening, I just would like to interview you guys and ask you about 10 questions on what you believe a nurse practitioner's roles and responsibilities are in a primary care setting, as long as that is okay with you guys.
Yep.
Yes.
Okay, I'm just going to first ask you to introduce yourself, starting with you, sir.
My name's Kevin.
All right, and you?
Creighton.
Perfect. Okay. So I'm going to first start off by asking each of you what you believe a nurse practitioner is. You can go ahead and begin.
Well, I always assumed it was like a physician's assistant that would act instead of a doctor, but was still able to do prescriptions and things like that.
Okay, and you?
Yes, the same. Someone who is working beneath a physician in, a doctor's office, a clinical setting to see patients, to help them with their workload, give prescriptions out, that kind of thing.
Perfect. And you both pretty much have it. They're allowed to work independently, depending on the state that they're practicing in, or in collaboration with physicians. They can diagnose patients, they can treat patients, or they can prescribe certain prescriptions depending on, again, the state that they're practicing in. Some can do narcotics and some cannot. So, perfect, you got it. And then, kind of going along with that, what do you think a family nurse practitioner can do? Kind of the same thing.
Well, I guess do exams or exam patients that have issues that want to find out maybe what's wrong, get treatment, basically.
Yeah. Same. Like you said, prescribe medications if allowed, and diagnose patients, and then relay the information to the physicians.
Mm-hmm. And again, you got it. They diagnose and treat patients, again, independently or in collaboration with physicians. They do exams, they can do lab work, they can do diagnostic work, x-rays, CT scans. They can send off for, or again, prescribe medications. And it all, once again, depends on the scope of practice within the state they're working with, depending on if they can do that independently or if they have to work in collaboration with a physician. And then, can a family nurse practitioner diagnose illnesses?
Well, yeah, that's what we would hope. Nowadays it seems as hard as seeing a doctor, so you look forward to seeing someone that can help, so yes.
Yeah, absolutely.
You got it. Perfect, both of you. And again, that pretty much falls under what you said. They are and what they can do. They diagnose and treat patients. Whether that's just doing exams, sending off lab work, doing those diagnostic tests, and prescribing medications for patients. So absolutely, they can diagnose illnesses. And then the next question is, can a family nurse practitioner manage chronic and acute illnesses?
Well, I guess so, although, I would think if somebody was a chronic patient with an illness, that I would think they'd be seeing a physician full time, but again, nowadays it's very difficult to get into physicians. There seems to be a shortage, so I'm not sure.
I would think that yes, they could, working alongside the physician to try and treat the patient to the best of their ability, and try and get some help for the patient, and just kind of go back and forth with the physician and try and figure out, the best treatment options plan for the patient.
And you're both absolutely right. That there's more nurse practitioners coming into practice nowadays because there is such a shortage of physicians. So more nurse practitioners and even PAs are coming into the working practice of primary care. So yes, more nurse practitioners are working in acute and chronic settings, diagnosing and treating patients. I think there was a study that said, nurse practitioners are treating more, acute settings, and physicians still are treating more of the chronic patients, but they can do both, absolutely diagnose and treat those patients. And if they do have a question about something, even if they are working independently, then they can, ask for a referral. They can collaborate with that physician to get help if they need to, so that patient gets the best treatment possible. Do you think a nurse practitioner has to collaborate with a physician?
Well, I would say yes, especially that situation where somebody's dealing with a chronic, illness, a patient like that, something minor, I don't know that they have to now.
I would say legally, yes, you have to.
And it depends on your state, once again.
Mhm.
Some states, nurse practitioners do not have to collaborate with physicians. They can work completely independently. North Carolina is a restricted state. So in North Carolina, we as nurse practitioners do have to collaborate with physicians. So there's like all career long, you have to delegate and be supervised by a physician. And whether that's just whether you're in an office with them and you have a physician that works alongside of you, or you have to get a physician to look over and make sure you're doing everything correctly. You do have to have that supervision that your physician that you are collaborating with. But it completely depends on the state that you're practicing with. There's I believe more states that are not necessarily restricted, but they're either restricted or they do require some physician that you have to collaborate with. And then states that do not, there's not many states out there that nurse practitioners can completely work independently by themselves, but that is something that we're working on because we want independent scope of practice that you can work by on your own and not have to have everything be questioned by everyone else. Can a nurse practitioner order diagnostic tests?
Yes, I think we've determined
Yes.
that they can do whatever is necessary in order to help treat patients.
And absolutely right. They can order labs, chest X-rays, any kind of CTs, anything that they think that the patient needs to diagnose and treat that patient, then they can order. Absolutely right. Can a nurse practitioner do simple office procedures?
I'm not sure. I would imagine they could. I don't know what would be a simple procedure though.
So I say yes to like do mole removals,
Okay.
injections.
Alright.
Yeah, I would say yes.
Yeah, and absolutely yes, you're correct. They can they can do sutures if you need it in an office. Biopsies, mole removal, like you said. If you have pain management, or if you need it to interpret lab work or CT. If you need a cast or anything like that, anything that is simple that you need in the office, absolutely they can do that. Can a nurse practitioner write prescriptions or prescribe narcotics?
Yes, prescriptions. I think maybe on the narcotics it's getting harder and harder.
Yeah, I think it's just hard in general. There's such a, when you go to a doctor now, it's so difficult to get just regular medication, not let alone narcotics.
Yeah.
So I think it's
Absolutely. Yeah.
dependent.
Absolutely, and you're both correct. They can write prescriptions, and then again, it depends on the state that you're practicing in, on what prescriptions they can write, and then if they can prescribe narcotics. If they can prescribe narcotics, they need like your DEA license to do that. And then in North Carolina, you can prescribe, dispense, and procure certain substances, and they all fall on scheduled substances. You can do the high abuse potential drugs that are like morphine, codeine, Dilaudid, methadone, Demerol, Tylenol with codeine, Xanax, all those you can do. Antitussives, antidiarrheals, they can do all those. So they can do them. You just have to, again, you working with a physician and a physician that can do them in North Carolina. Can a nurse practitioner bill for their services?
Well,
I have no idea.
they gotta get paid, but I don't know how that works.
I know PAs do, but I don't know about nurse practitioners. I don't know the answer to that.
They can, just like PAs, just like doctors, they have to get paid, so they can be reimbursed for any care that they provide to patients. They just have to, make sure that they appropriately are putting in the diagnosis for the patients and the type of encounter they have for the patients. They're using the appropriate codes for the patient, and that they're getting reimbursed appropriately. If they are working in collaboration with a physician under Medicare payment rules, NPs can bill directly for services. It's called like incident to, if you're working with supervising physician, and if conditions are met, then they're getting, I don't think they get paid the full amount. The physician gets paid some, the nurse practitioner gets paid some, so they won't get all of it, but they will get paid some.
Gotcha.
And then, What is the difference between a nurse practitioner and a physician assistant?
I don't really know, I'll be honest with you, I don't know if there is a difference, or if they're similar under two different names, or if there's actually, if they're two distinct professions with different responsibilities.
So the thing is, you used to always only see PAs, and now you are seeing more and more nurse practitioners that are stepping in the role of PAs.
Right.
So I would think that they're basically doing the same things. I don't really know how to differentiate between the two, honestly, and what their scope of practice is, because it seems very similar.
And you're very true. They both have similar scope of practices. They both, you know, nurse practitioners are similar in that they, you know, went to school. They both are attending their master's program. PAs are more based on medicine, and nurse practitioners are, of course, based on nursing theories and everything. And then PAs follow a medical model, and are primarily medical trained, and they are practiced everywhere that doctors can be found. A lot of times you'll find them in acute settings and ambulatory settings, surgical settings. Nurse practitioners, a lot of times you'll find in primary care settings. And then nurse practitioners work in collaboration with physician and other providers. And then PAs a lot of time are independently licensed and practiced and regulated by the State Board of Medicine, while nurse practitioners are regulated by State Board of Nursing. So they're very similar.
So PAs can independently practice. Nurse practitioners cannot.
Yeah. So they both can prescribe. They both can diagnose and treat patients. But the nurse practitioners work in collaboration with the doctors and everyone, and they want that autonomy that doctors have, and they're working to get that autonomy, but we definitely have not obtained it yet. That is all the questions I have.
Oh, very good.
Do you guys have questions about anything?
Well, that was very informative, because I did not realize the difference.
Well, thank you very much.
Thank you.
Thank
I
you.
appreciate you both taking the time to work in this interview with me, and y'all have a very good day.
And I wish you well in your studies.
Yes.
Thank you so
Good luck.
much.